I'm Kathleen. I'm the nurse manager on the unit.
Nice to meet you.
Nice to meet you. How are you doing today?
I'm doing well. How about you?
Good. I'm well. So tell me, what made you want to apply for this ER position?
Well, right now I'm actually, my last semester in nursing school, I precepted in the ER, and going into it, I was ER was never really on my radar.
Right.
I never really thought about it, but then I got in there and I just fell in love. Like, I loved the fast pace and getting to see a wide variety of different patients.
Mm-hmm.
But I had a really great experience.
Good. Why do you think you are the best candidate for this position?
Well, I don't like to brag over myself, but I will.
Go for it. Let's hear it.
I just think that I'm a very hard worker. I'm very good at listening to positive criticism about, like, I'm willing to take that criticism and, better myself with it. And I'm very open to different ways of doing things, so I can be flexible.
Okay. And when you're speaking to people, would you prefer to speak directly to them, or would you like to leave a memo, like little sticky notes on a chart or something?
Are we talking about, sorry, I just want to clarify, about to patients or to staff members?
Let's go with the doctors, because you work so closely with them in the ER. Would you prefer to ask them a question directly, or sometimes it's just so chaotic they will leave a sticky note on their computer? So tell me why you would want to speak directly to them or why you wouldn't.
I would actually prefer to speak directly with the physician. I know in the beginning of my preceptorship, I was really scared to talk to the doctor. Like, all through nursing school, that's like the biggest fear is talking to the doctor. But all of my experiences, it has been better to directly talk to the physician, because most of the time it's something that maybe they just forgot about or they didn't catch on. Like, one time we had a couple come in and the physician totally did not know that they were a couple, and he was trying to send one of them, transfer them to another hospital, and we had to inform him that, hey, this other one, your other patient, that's her husband, so we need to keep him informed that she's getting transferred, because he was the second in line for her medical decisions and everything.
Okay, good. And tell me what success means to you.
Success, that's a good question. Success means to me that you have been able to make a difference. That to everybody it might not be the same, but it's based on what your goals are. So if you're able to meet your goals or go above and beyond, that to me is you've made a success.
And now tell me, what does failure mean to you?
Failure to me is not being able to reach those goals, but in the sense that you don't have the motivation behind it to reach those goals. It's not that you tried your hardest and just couldn't get to it. It's that you didn't have the passion behind it to reach that goal.
That's a good point. Now tell me how, just in your everyday life, I know you're still finishing up nursing school, but how do you organize yourself for a day-to-day activities?
Well, that's one thing I've learned a lot in nursing school is how to organize and time management.
Right.
I have gotten very good at what I like to do is for like my day-to-day, especially like when we're in the ER and stuff, like, okay, yes, we need to do these like routine things in the ER, like we have to check the defibrillators and all this stuff, but if we get patients, obviously they're going to take priority.
Right.
So I've kind of gotten good at making a mental list of these are things I need to do, but aren't type priority. These are things I need to do, that are priorities, so I can come back to these
Okay.
as I get time.
Good. Good. And tell me about the one thing in your life. It's either with nursing, without nursing, that you're the proudest of.
I think, that's a tough question. Did I finish nursing school?
Other than that, we already know you're going to do that.
My proudest accomplishment, I think, is actually from my preceptorship, because I felt the most like an independent nurse. Like in all my other clinicals, yes, it's been very beneficial. I've learned a lot. It's exposed me to a lot of experiences. But in my preceptorship, being able to like go into the patient's room feeling confident that, okay, this is what I need to do, already formulating like in my mind, okay, this patient's presenting with this is probably what the physician's going to order, so I can already be ready for him, because it's very fast paced in the ER, like we want to get them in and we want to get them out. So having that already in my mind, I think has been something I've been proud of, that I've been able to catch on to.
Good. I like that. And where do you get your sense of motivation?
My sense of motivation really is, I love caring for my patients. My patients are really what made me want to be a nurse. Yes, sometimes they can be very difficult, but in the end of the day, it's really my patients being able to provide them with the care they need, or being able to give them the resources to better their health, because a lot of them just don't have the knowledge, so being able to share that and better their lives, their quality of life, all of that really motivates me.
Good. Now, I mean, you're talking about how your patients motivate you and push you to do better. Do you have a patient that stands out the most as your most memorable patient?
Well, I've had a lot of memorable patients in the ER, just because you see such a wide variety of cases. But I have to say, one of the most memorable was we had, she was in her late 70s come in, and she was brought in by EMS with a core temp of 86. And in my mind, I'm like, this was like my first day in the ER. I'm like, oh my God, like, but it was a really good experience, because it showed me how to operate within the ER, because I precept down at the Woodstock ER, which is only a 12-bed emergency room, so it's very small, and learning to work with what resources you had, because obviously this was a very critical patient. We needed to get her stabilized. So being able to decide, because we had other patients that needed some of the resources, that, okay, who can we take off the blanket warmer because they're stable enough to put on her, because she was taking top priority.
Good. Now, being in the ER, we definitely have to work as a team. Even though you're assigned your own patients, you still rely on the other nurses on the unit to help, and for you to help them. Can you define teamwork for me?
Teamwork is, to me, being willing to collaborate with each other, and not necessarily just nurse to nurse. It's all within the interdisciplinary team. Being able to, also communicate that need for a give and take, basically. It's not like you're taking everything from them. It's, okay, hey, can you help me out here? But still being able to, if they need help later, being there for that person, not just, like, oh, sorry. Yeah.
Right. Okay, now tell me, what are your most remarkable skills? I know you've learned a lot in class, but what do you think stands out as your most remarkable skill when it comes to nursing?
what I have been told a lot from my clinical instructors and preceptors and even my patients is that one of my best skills is my bedside manner. I've been told that I have very good bedside manner because I take the time to listen to my patients. Like if my patient needs me to sit there for half an hour and tell me their whole story, I will sit there and listen to their whole story because that's what they need to get out. Might not necessarily be the easiest, but it's definitely, I think, important to be able to actively listen to our patients.
All right. Well, I like everything you've said, and do you have any questions for us right now?
Well, what kind of schedule do you have in the ER? Are you doing 12-hour shifts, 10-hour shifts?
Our normal shift, I guess you could say, is a 7A to 7P and then a 7P to a 7A. We do have some random shifts where it's a 3 p.m. to a 3 a.m. We do also, depending on where you are in the ER, there's an 11 a.m. to an 11 p.m. And depending on if we need to call people in, there is a 1 p.m. to a 1 a.m. But most frequently our nurses are on a 12-hour 7 a.m. to 7 p. or 7 p. to 7 a. We are looking for the night shift nurses. So it would be the 7 p. to 7 a. Again, normally you're working 3 to 4 days a week. There's a lot of options if you want to pick up. A lot of nurses do jump around their schedules, so it's our group is very tight knit. So if you need a day off, and they'll cover as long as you cover. But right now we are hiring for the night shift.
Okay. And how long is your orientation phase on this unit?
For the ER, we have about a 5-month orientation. Where you are assigned to a nurse. Now, since we are looking for the night shift, your orientation will be on days. Just there's more staffing, so that's why we put you on days, and then you'll orientate over into the night. We won't just throw you in by yourself. We'll always have, we'll check up on you every month, every week, every so often to see how well you're doing and if you're getting comfortable. And we're definitely not going to let you go if you're not comfortable. So there's going to be a lot of communication along those 5 months to decide whether if you're ready to go on your own or not.
Okay, that sounds wonderful.
Good. All right, well, we will be in touch. It was nice meeting you.
Nice to meet you too. Thank you so much.
You're welcome.